Welcome, everyone. Okay. Yeah. Welcome, everyone. We're going to get started because we had a little bit of technical difficulty, but of course, we'd like to thank Lori McClory, who is like our technology wizard over here. And just a moment to tell you, October 27th, the Center Presents will have a family fright night outside behind South Cove with a master storyteller around fire pits. But looking at the weather, you'll need to put your woolies on. Bring a blanket, but it should be fun. Simon Brooks is a great storyteller. Anyway, tonight it's my pleasure to have Center present Transgender 102. Dr. Turco and his colleagues are again going to give us information on understanding and appreciating gender identity, especially of generation X, Y, Z. And for those of you who don't know, Dr. Turco is a professor at Dartmouth at the Geisel School of Medicine, and he's co-director of the Transgender Clinic at Dartmouth Hitchcock. So it should be a very interesting program, and we welcome Dr. Turco and his panel.
Thank you. Well, I was told since I've been vaccinated, I'm more than 5 feet from you, I can keep my mask on when I talk, so that's good. Second of all, many people have asked me, if I didn't go to 101, can I come to 102? Perfectly fine. I hopefully this won't be too redundant. I'm curious, should I use this?
That's up to you.
I thought, can you hear me okay? Okay. How many people were at the first one last year? Okay. Some of this will be somewhat redundant, but we're going to try to make it not redundant. And I put this up here because over the last year or so, several of my colleagues and friends from Eastman have asked me some of these questions. I consider myself a liberal-minded individual, but I just can't seem to wrap my arms around this transgender issue. Can you help me? So hopefully we're going to try to do that. Somebody else said, if there's so many transgender individuals in the world now, where were they when I was growing up? Okay, and that's I've heard from several people our vintage. I say our vintage, I'm sure there's some young people in this, maybe everybody's younger than I am, but some really young people. And then also I'm hearing more and more from parents and grandparents, similar stories. I have a 5-year-old grandson who only wants to play with dolls and befriend girls. Can you be sure at this time if he would be a transgender woman as an adult? Yes.
Would you mind using the mic, especially when you're facing the other way? It's a little
okay. Yeah.
Thank you.
All right. All right. So I'm going to start off. I'm going to first have my colleagues introduce themselves. This is Emma LeBlanc, who I'll let you introduce yourself in your role.
Yeah. Hi, everyone. My name is Emmett LeBlanc. My pronouns are he, him, his, and I'm the program manager for the Transgender Health Clinic at Dartmouth Hitchcock.
Right, and I should have said my pronouns are also he, him, and his. And Derek Alden.
Yes, so I'm Derek Alden. I use they, them pronouns. I'm not associated with Dartmouth in any way. I'm a recently graduated computer science student from the University of New Hampshire.
And thank goodness, because Derek was able to help us work through all of these difficulties. So first of all, I have this slide up, this transgender umbrella with a lot of terms. I think one of the things that's intimidating when you talk about transgender issues and also gender identity is so many of these terms that people get confused by, and it puts you in a daze trying to figure out what people are talking about. And all I would say is that these terms change dramatically year to year and so forth. So don't be intimidated. If I hear terms, I always ask the person, what are you referring to? Because quite frankly, some of these terms, if 2 or 3 different people use the term, they may mean something slightly different. So please, tonight, if you have a question, if you hear a term that you're not sure about, please raise your hand and we can answer that. The other thing I was going to say, for those of you joining us on Zoom, if you do want to use the chat line or the way you ask questions on Zoom, it may not be called chat, that may be WebEx. Derek is kind of looking over this. Is that working, Derek? Do you know? Okay.
Yep, just fine. I've already got one question.
Okay, super. So I'm an endocrinologist, and I'm going to start off by talking a little bit about what sex is. When you think about it, we've used that term sex ever since we were in kindergarten. We were filling out forms, SATs, later on in life, tax forms, and it would always say sex, male or female, and you're supposed to check one or the other. And when you think about it, that word sex is a lot more complicated, than just is it male or female. And so I'm going to talk a little bit, we're going to talk about gender identity, and Emmett's going to talk about gender identity, but we're also going to talk about genetic sex, phenotypic sex, and then also sexual orientation. So I want to first start off by saying that in the upper right of that diagram is undifferentiated gonad. So we all started off when the sperm fertilized the egg, that our genitalia had the ability to become either male or female genitalia. Okay, so you could see the gonad, the undifferentiated gonads. And what was going to determine whether or not that fetus was male or female, or had male or female genitalia, was whether or not it had two X chromosomes or an X and a Y chromosome. And if it had a Y chromosome, there was a gene, this SRY gene on that chromosome that would go to the undifferentiated gonad and have that gonad turn into a testicle, making testosterone. If there was no Y chromosome and there was no SRY gene, then that undifferentiated gonad evolved into an ovary and would make estrogen. Okay? Now, internally, you can look below here on the left versus the right. On the left, the internal genitalia, if it was bathed in testosterone, would become a prostate and male genitalia. Whereas if there was no testosterone, but there was estrogen, then this internal genitalia would evolve into fallopian tubes, uterus, female genitalia. Okay? Now, in addition, so that's called biological sex. So if somebody said, "What sex are you?" you could say, "Well, you mean biological chromosome sex?" If they ask you that, you could say, I'm 46 chromosomes, 2 of which are gender sex chromosomes. You either have 2 X's or an X and a Y, for 99% of people. Okay. Now, next sex we need to talk about is so-called phenotypic sex. Phenotypic sex is if I took my belt off and pulled my pants on, which I promise I won't, and you looked at my genitalia, you'd probably say that looks male or looks female. Okay, that's phenotype. Okay, and what causes that? Again, you can see in the top, that's showing the undifferentiated genitalia of a newly fertilized, developing fetus. If it's bathed in testosterone, then what's going to happen is that you're going to go down that left pathway and you're going to form a pedis, scrotum, and descendant testicles. Whereas if there's no testosterone, if instead that undifferentiated gonad became an ovary and made estrogen, then you're going to go down the other pathway and you're going to develop a vagina and female genitalia. That's phenotypic sex. Now that's important because later on we're going to talk about gender identity. Okay, and I'm wondering how were you gendered? No, but I mean how, who, and when?
Birth certificate.
Okay, how are you?
The obstetrician who pulled you out and said it's a boy or it's a girl.
And how did the obstetrician know?
Well, the female genitalia or the male in particular.
Exactly. So really, our phenotype determined our assigned gender at birth. Okay, assigned, and now about 50% or plus babies are assigned gender before they're born because of ultrasounds. If you do an ultrasound and you see a little penis squiggling around, the fetus becomes the little boy. Okay, so that's phenotypic sex. Okay, now we want to go on and talk about gender identity. And I'm gonna let Emmett talk about that, and we'll see, remember, now this fetus was born, developed, was born, and was assigned gender, male or female, based on their genitalia, okay? Now, tell us more about gender identity.
Sure.
Absolutely. So here we have the gender unicorn. It's a really great image. It's going to tell a lot of information. So Jack talked about the sex assigned at birth. So when the doctor or the nurse pulls you out, says, oh, that's a penis, it's a boy, or oh, that's a vagina, it's a girl, right? That's kind of how it typically goes. Usually that lines up. So somebody who is assigned female at birth is going to grow up, live their whole life, and identify as a female. Some people are going to be assigned male and live their whole life and identify as male. That's their gender identity. The whole life, through and through, they identify how they were assigned. So those two things line up. So those people are considered cisgender. So if you were assigned male at birth and you identify as male, you're a cisgender male. And if you were assigned female at birth and you identify as female, you're a cisgender female. Now, if those don't line up, so you're assigned female at birth and somewhere along the line, whether you were 3 or 93, it doesn't matter. Somewhere along the line, you say, I'm not a female, I'm a male, I'm a guy. You're a transgender male. And if you were assigned male at birth, and somewhere along the line, whether you're 3 or 93, say I'm a woman, you're a transgender female. And so that's kind of the differentiating between gender and gender identity. So we have our sex assigned at birth, that's what the doctor determined based off of the look of the genitals, right? But that doesn't always line up. So when the doctor looks, sometimes they can't really tell if it's a vagina or a penis. And that's considered ambiguous genitalia. And typically that's considered a condition called intersex. In the kind of historical context, there's been some offensive terms that have been used to describe people that are intersex, such as hermaphrodite, but we don't use those terms anymore. So for folks who are intersex, their genitalia don't quite fit the boxes that we have kind of imagined. This is what a vagina looks like, and this is what a penis looks like. How many people here know someone who has red hair? Because I do. Okay, so most people in this room and probably on Zoom know somebody with red hair. So that same statistic is about how many people are intersex in the United States. So if you know someone who has red hair, chances are you know someone who's intersex as well. And the concept of intersex takes that gender binary of male and female and kind of throws it in the trash can, which is kind of cool. So we have our gender identity. It's our personal concept of self. It's who we are. Our gender expression can be masculine, feminine, somewhere in the middle, masculine one day, feminine another day. Sometimes our gender expression matches our gender identity. So my gender identity, I'm male. I present pretty masculine, I think. But I like to paint my nails. Does me painting my nails make me a girl? I don't think so. Because I think I'm a man. I know I'm a man, right? So our gender expression doesn't always have to line up with our gender identity. We also have our attraction. So sexual orientation is who we're attracted to. Gender identity is who we go to bed as, and sexual orientation is who do we go to bed with. Yes?
For people who are born intersex, on their birth certificates, does the doctor just choose, or?
That's a great question. Jack might have more info on that piece.
That question.
Yeah, the question was, babies that are born with intersex conditions, what is put on their birth certificate? And that's, a very controversial situation. And those kids are usually born with what's called ambiguous genitalia. I said I pulled my pants down, and you probably say I look male, okay? And these individuals, they have ambiguous looking genitalia, so it's not known. And there was a lot of pressure years ago to be able to determine, within 12 hours, 24 hours, what the assigned gender was going to be. And I can understand that, parents wanted to know, is it a boy or a girl? And there was a lot of pressure on the physician to decide, and it usually not faulted, that's the wrong word. It usually was a female designation. And the reason for that was a surgical reason. is that if somebody had ambiguous genitalia, it's easier to do plastic surgery to create a vagina than, and we all know a penis is not that intelligent an organ, but it's more difficult to design surgery. So as a result, there's a lot of pushback, and that we could spend the next 4 hours talking about that. There's a lot of pushback in the intersex and transgender world, saying we shouldn't assign kids a gender that quickly that have intersex conditions, but kind of give them some room to see what their mind eventually feels they are as far as gender identity.
Does that help? Cool. So our attraction is who we're attracted to. So we can have attraction for one gender, multiple genders, or none at all. And we could be attracted to people who are the same gender as ourselves or a different gender than ourselves. And we have different kinds of attraction. So you can be sexually attracted to men, but only romantically attracted to women. You can be romantically attracted to men and women, but not be sexually attracted to men. There's a wide range and spectrum within all of it. And folks can even be asexual. So they have little or no romantic or sexual attraction to folks. That's a little smaller than I wanted to. So pronouns. Somebody actually came up to me beforehand to ask me about pronouns, which is awesome. So why did I introduce myself with my pronouns? Does anyone know? It's okay if you don't. Yeah.
Because you might identify as a different gender than you appear in us.
Exactly, yeah. So the response was, I might have different pronouns than what you would assume. So even though my pronouns are he, him, and you would assume they're he, him based off of my expression, my voice, the facial hair I'm trying to grow, all that, that makes me obviously feel good because my gender expression is male, but that's not always going to be true. One time I was at a meeting with a group of colleagues pre-COVID, there was 20 of us in the room, and I didn't know, and in my head, I'd never met really any of the people, and I misgendered 2 people in my head. We went around, we did names and pronouns. And 2 of my colleagues used they, them pronouns, and I didn't know. And I wouldn't know because I made an assumption. So that's kind of why I introduced myself with my name and pronouns, so that we can normalize the conversation. It makes people feel safe and comfortable and feel like they're going to be respected when they say, oh, my pronouns are different than what you might think they are. How do you ask someone what their pronouns are? I would say, hi, my name's Emmett and my pronouns are he, him. What about you? And you can let me know. And what if somebody uses pronouns you don't know how to use? Like they, them pronouns. Well, we do it all the time without even realizing it. So if I was in like a coffee shop and somebody left their phone, I would be like, oh, someone left their phone on the table. I hope they come back and get it. Right? We do that all the time. If it was a purse, we might make that assumption it's a woman's purse, right? Because we put these sort of gender categories on items and gender expression, right? But we don't always know people's gender based on their expression. And practice, because you're not going to know unless you practice. So if somebody says that their pronouns are they, them, you can practice when you're in the car. You can practice when you're getting dressed in the morning. You can practice in your head when you're brushing your teeth. There are ways to kind of make things easier when you're going through pronouns. And when we're doing things like this, presentations, you go to a conference and you have a name tag on, it's super helpful to put your name and your pronouns on there so that people, when they're introducing themselves, they know, oh, that person's pronouns are she, her. That person's pronouns are they, she. Have you ever heard somebody use pronouns where they use multiple sets of pronouns?
Yes, but I don't understand.
That's okay. Yeah. So some people will use multiple pronoun sets. So that means like I have a couple friends, depends on the context of the situation. They might be more comfortable with me using she pronouns in front of people that don't know that they use they, them pronouns in other situations. So in environments where they feel safe and comfortable to use they, them pronouns, they'll use them. But maybe around their parents or at church or maybe work, they might not use those pronouns. And there are other folks who they like when you use a mix of pronouns in different conversations. So my friend loves when I say she, they in the same sentence. So if somebody said, oh, where did Rebecca go? I'd be like, oh, yeah, she went to the bathroom. They'll be right back.
Question back.
Oh, yeah.
I've seen it, we're in the early days of work with pronouns, and there's a third one that's used, like he, him, his.
Yeah, so he, him is like a masculine pronoun, and then she, her is feminine pronoun. We have they, them for kind of a gender neutral pronoun. There's z, zir.
If I may, I might have misunderstood the question. Were you asking about when someone says three pronouns? Like right now on my name, I have they, them, but if I had instead written they, them, theirs, are you just asking about the meaning of the third pronoun?
That's it, the three.
Sure.
They, them, theirs.
Yeah, so like, it's like if you have he, him, his and theirs are like the equivalent, if that makes sense. So that backpack is theirs. It belongs to them.
But I think what you're saying is they're telling you that where it's used grammatically, it might be he, him, or his. That's the range of the pronouns that are being used. Doesn't mean they always go my pronoun is he, him, and his.
Yeah, I'm just seeing it in the email signatures, after their name, they
Right.
put all three.
Yeah,
Yeah, I think he, him, is, or like they, them is just kind of a shorter version of doing the same thing. Yeah.
If you're a grammar nerd, the third pronoun is the possessive pronoun.
Oh, I think. Oh yeah, because I couldn't open the link.
yeah, we couldn't open
I had a link that I was gonna show, but I couldn't open it, so, sorry.
Yeah.
That was my piece. I just wanted to talk a bit really about the language, make sure we're kind of on the same page. I have another question.
You started talking about, sorry, I'm saying it wrong, Z.
Oh, easier pronouns.
Yeah.
I don't know a lot of people that use these pronouns, but there are people that do use them. And so it's kind of in the same context of using they, them pronouns or he, him pronouns. You just replace it with z'er. So, Z went to the bathroom, they'll be right back, stuff like that. And there's a pronoun game online. If you just look up pronoun game, it's like an online website. You can practice different sets of pronouns.
Derek, maybe you can help us here, talk about your pronouns and also in general pronouns.
Sure, I'd be happy to. I think the thing to remember about pronouns is that using someone's correct pronouns is really just treating them the way they want to be treated. You don't have to understand why they're asking for that. You just treat them how they want to be treated because that's the golden rule that we all know, right? So for me, I use they, them pronouns because I'm gender fluid, which means that sometimes I'll wake up and feel like I'm a man. Sometimes I'll wake up and feel like I'm a woman, and it kind of wobbles back and forth over the course of a week or so. And that's not super common. You don't have to know about that or understand that. When I introduce myself and say, hi, I'm Darek, I use they, them pronouns, we don't need to get into that. You just can use they, them pronouns for me. And that's why I chose they, them pronouns specifically. Sometimes I'll want to use more male pronouns. Sometimes I'll want to use female pronouns, but it would be super unfair to just ask people to keep changing all the time. And like, maybe I would do that if it was someone I was comfortable with, but in a venue like this, where I'm introducing myself to hundreds of people who maybe are going to talk about me to their friends, I don't know, but who I'm not going to have like that close interpersonal relationship with, it's easier for everyone if I just, go by they, them, because that kind of is comfortable no matter how I'm feeling on the day. And that way you don't need to worry about it. I introduce myself that way, you use them when you're referring to me, and that's it. And if you have someone in your life who is trans, and I don't know if that's going to be the case for all of you, but I'm sure at least some of you came here because like there's someone in your life, a kid or a grandkid or a coworker who is transgender or who you think might be, and you want to know how to, deal with them in a good way, how to show them that you care about them. Practicing someone's pronouns so that you get it right reflexively is a great way of validating them and saying that you care about knowing them and that you care about, treating them respectfully. So when we're talking about practicing pronouns, it's just because, if you don't practice, you're going to make mistakes. You might make mistakes anyway, and mistakes are okay. But, if you're constantly making mistakes, you're kind of subtly telling someone, I don't care, how you're presenting. I don't care about this thing that you told me I should do for you. So if you take the time to practice, it shows that you do care. It shows that you're trying to understand, even if that's hard, even if it takes work, you can practice using someone's pronouns in order to have it be reflexive. You don't have to worry about misgendering them. Shows that you care. Everything goes smoothly. So I feel like I really should have organized that thought ahead of time. But does that kind of cover people's general questions about pronouns? Because I'm happy to go into more detail. One of my hobbies is that I'm a language nerd, so I can do the grammar for you if you want.
There's a question back here.
Yes,
Sure.
Could you do the grammar? I mean, do we say
Yeah,
they?
absolutely. So pronouns, it's right in the name, pronouns. They're a grammatical particle that stands in for a noun. So for example, I have here a bone, and you can't really see that. I have here a bone that we found by the side of the road and cleaned and used as a window decoration. If I was trying to talk about this bone in a sentence, I might say, oh, where's the bone? It's on the windowsill. It there refers to the bone, right? It's a shorter word, so I don't have to keep saying the bone over and over again. Basically, every language uses pronouns in some way. English uses gendered pronouns, meaning that what pronoun you use for something depends on its gender, right? So bones, they're inanimate, they have no gender, it's a bone, it's an it. But it would be incredibly, sorry.
That wasn't the question. There was a question about, do they say they are or they is? Like if they're using your pronoun, how do they?
I'm so sorry, I misheard. So, right, so if you're using they, them pronouns for someone, pluralize the verb. And I know that that sounds a little weird, but if you just relax and don't think about it, that's actually the normal English rule for things. So for example, the example that Emmett did earlier about an unknown person leaving their phone, well, we say that person left their phone, not that person leaves their phone, right? Or sorry, that's a bad example. I mixed tenses. If we saw someone in the process of abandoning their phone, we would say, hey, they are leaving their phone. Same thing if you know that someone uses they, them pronouns, use the plural form of verbs. And that, I know it can sound weird, but it's what people do naturally when they're talking about unknown people. So just do that same thing. If it sounds grammatically incorrect to say they is, then don't say that. We're not asking anyone to break grammar. They are continues to be the correct way. So yeah, if you were talking about me, you could say, you know, Darek told me some interesting things. They're a panelist who worked with Dr. Turco.
okay, so yeah, let's move on and then we'll have some questions at the end. I just wanted to mention a few things here kind of as a summary for this first part where we're talking about gender identity. And that's things I've learned is assigned gender is again, the gender assigned when you're born. The affirmed gender might not happen to 2, 3, 4 years old where a little kid looks in the mirror or can identify as a male or female. And that's the affirmed gender. It was alluded to that may not have happened until somebody was 20 or 30 or 40. And certainly when I first saw transgender patients 20 or 30 years ago, often they didn't really figure out that they were transgender until the 20s or 30s because there just wasn't that information around. They felt there was something wrong, but they couldn't really put their finger on it. Now, and we'll get to this at the end when we talk about young kids that are presenting at 2, 3, 4, 5 years of age with some so-called gender dysphoria. In other words, gender dysphoria is having dysphoric feelings due to the fact that their affirmed gender doesn't match their assigned gender. You know, they're born a little an assigned boy, but they're feeling like a girl, and that causes a lot of distress, can lead to depression, anxiety, and so forth. So gender identity development, we didn't talk about that. You know, what allows somebody to develop their gender identity? There was a lot of feelings back in the 40s, 50s, and 60s that whatever you were assigned at birth, and then you were nurtured to be a boy or a girl, that you would adopt that as your gender identity. Now, it is true that most individuals will be assigned one gender, say male, and will affirm later on, 2, 3 years later, that they are a male. However, there is, 1% or so of individuals that's not the case. And so people looked at it, that maybe it isn't nurturing, maybe there is some nature, there is some genetics, there is some hard wiring that leads to some gender identity that can at times be different from your assigned gender or what your phenotype is, what your genitalia look like. And as an endocrinologist, and I have an eminent endocrinologist sitting in the front row, and I'll ask him, do we have any better understanding of what leads to gender identity?
No, not specifically, no.
Yeah, so it's still a mystery.
We had
The
someone
problem-
on Zoom asking that when an audience member speaks, if you could repeat it, because the audio from the audience members isn't coming through clearly.
Okay. So the other thing I wanted to mention is gender identity. We've talked, when we were all growing up, we thought of gender identity as being very binary. You're either a male or you're a female. Well, it's clear now that that doesn't really encompass it. That's more of a spectrum. And there are individuals that are on the spectrum. I think, Emmett had talked a little bit about some of his feelings, and Derek also about their feelings that are more on the spectrum and can change. So it's not a binary phenomenon. And then gender dysphoria, again, is the distress, and that's what causes a lot of problems, because gender dysphoria is what can lead, and we'll talk about this in the case that we're going to talk about, to really uncomfortable feelings that can lead to increased incidence of suicidality in transgender individuals just because they get so dysphoric over their situation.
I would just add real quick.
So gender dysphoria is a diagnostic term. It replaces gender identity disorder from a DSM, which is the statistic manual for psychological disorders. So it used to be considered a mental illness to be transgender. It's not a mental illness to be transgender. And so gender dysphoria is the diagnostic code for treatment purposes. So folks who are transgender, so that they can access medical care, they need to have this diagnosis. So they have to have shown persistent disease, discomfort with their body and or with their gender in order to receive the gender affirming care that they're looking for. On the flip side, there's gender euphoria, which is kind of a term created by the community, the trans community, to kind of represent the feelings that they get when they experience gender alignment. So examples would be a transgender man being called sir, or when you're in a waiting room and you have, maybe your chart doesn't say what your name is, but they say your name anyways. So they say the name that you go by. Putting on a chest binder for the first time. So if a trans man has tissue on his chest that he wants to flatten, he might put on a chest binder, look at himself for the first time and be, wow, this is cool. So those are some experiences of gender euphoria.
Can I chime in about gender euphoria as well?
Absolutely.
I'll mention it's not just something that trans people feel. Like, it's totally possible for a cisgender person to do some gendered activity and be like, wow, I like this activity. I like being this gender. It's just not as common for them to remark on it and like call it out with a specific word, because it's like a fish having a word for water, right? Like if you're not trans, you don't kind of need a separate word for that because it's just you like being you. For trans people who've had their gender identity kind of suppressed or denied, or it's just they've had trouble coming to terms with it, finding the right information, having a word for that distinct feeling of enjoying a gendered activity because it fits you is a useful word for discussing these sort of things.
Okay, we've got about 5 or 10 minutes before we go to the second half. So are there questions concerning gender identity? And I know it's hard to wrap your arms around a lot of this material, and I'm just curious if there's any comments, questions? Yes.
I really appreciate you telling us, explaining,
Derek, I really appreciate you explaining why you use they, them. It is something that I struggle with understanding, admittedly, and want to understand. So would someone that's non-binary also not consider themselves male or female? I know you said some days you wake up and feel male, some days female. So does that also work where you don't feel like either one?
So that's a great question. And the answer is that non-binary is like transgender, it's an umbrella term that covers a number of different specific feelings. So I'm both non-binary and gender fluid. Non-binary meaning that I'm not only a man or a woman. Gender fluid talking about the specific feelings I get of moving back and forth. Some other non-binary people might, for example, be agender. They don't feel any sense of gender at all, and they don't want to be associated with gender. Or they might feel some distinct third gender, right? Like there's a movement in France actually that has like a third gender that people can identify with, and that's non-binary because it's kind of off of the binary choices. It's a third option. And then there's other people, like for example, bigender people or Native American people who are two-spirit, who feel multiple genders simultaneously. And all of those different experiences, they're all just different from the ordinary male, female binary that we're normally presented with. So all of those people use non-binary as an umbrella term. In general, if you're talking to if you know one non-binary person, you know one non-binary person. If you're talking to someone about their gender, they can talk authoritatively about their own experience, but that doesn't necessarily mean that it will generalize to all other trans people or all other non-binary people, because there's a lot of variety there. So does that answer your question?
Yeah.
Yes, let me run back here.
So on that same, I guess, stream of thinking, if somebody is transgender male, would that person identify as binary because they have a male, female?
Yes, exactly. We call male and female trans people binary trans, but again, it's kind of a less common word because that's kind of the default assumption. Most people are some form of binary, whether that's cis or trans. So we do call them binary trans people, but it's also not as common a word because it normally doesn't need to be specified.
Other question, comment? Okay, so let's move on then. We're gonna use a technique that we use a lot in medicine to teach, and that's to present a case and have a discussion centered around the case. So I'm gonna start to present this case, if I can. This a little bit. Okay, so we're talking to residents or medical students, or you're gonna be the medical providers in this case. So you were seeing in your family medicine practice a 25-year-old mother of 2 young children. You were seeing her for symptoms consistent with a urinary tract infection. As she's leaving the office, she stops, closes the door and says, "Doc," and the doctors in the audience know that happens all the time. "Oh, I got one more question for you," and it's always the big one. "Doc, I have one other issue I would like to ask you about." She explains to you that her 5-year-old daughter, Alice, has recently and persistently been telling her, "Mommy, I am really a boy." She refuses to wear dresses, and when she had her 5th birthday party, she only wanted to invite boys. Your patient wants to know if she should worry about Alice's behavior and what she should do. She brought the subject up with her husband, who brushed it off and said, "She's just going through a stage. It won't last. Let's look for an all-girls summer camp so she can go to make some friends with girls." Okay, I'm going to continue to use female, and Derek pointed out I could switch at this point, but I think this kid, this certainly not at this point, we're going to say this is a transgender kid. This is a kid that's got some kind of gender dysphoric feelings about their gender at that particular time. So how would you respond to her if you were the doctor, 5-year-old kid? First of all, have you seen any kids or your own kids or grandkids that can play with dolls if they're a boy and so forth? People are nodding. That's very common. So what would your advice be at this point? Because this is happening more and more often in the doctor's office.
Wait and see.
Wait and see, okay? Anybody, yes?
Say, have an open conversation with your child about the child's feelings.
Yep, okay. Andy?
Go to a co-ed camp.
Go to a co-ed camp. Anybody think going to the girls' camp is a good idea?
No.
No. What would you tell the parents about, gender roles? As far as pushing or stepping back? Go ahead.
I would definitely say to step back and let the kid explore different,
Right.
choices, explore different things.
Yeah, and
Jack, you need to repeat that.
yeah, it said, they were saying that we would step back and wouldn't really push being, do all girly things or all boy things, let them explore what they want to explore. And I think one point we would say at this point is that many kids do that, and many kids explore, playing with dolls or kind of, you could say, girls doing boy things and boys doing girl things. The overwhelming majority of these individuals are not going to be transgender, and there's no emergency to really do anything at this point, other than to just keep the conversation up, as somebody said, and see how things go. Okay, any other comments, Derek? Or Emmett, do you have a comment?
No, not at the moment.
Okay, so we both agree the father's recommendation is not a good one. Fathers try, but Alice's mother returns to see you 2 years later, along with her husband, but without Alice, who is now 7 years old. They report that if anything, their daughter's feelings about being a boy have gotten stronger and more persistent. All her friends are boys, and she refuses to wear any clothes she feels are too girly. They were called by their daughter's school teacher recently, who told them that Alice had gotten into a fight on the playground when some boys refused to let her play in a boys-only pickup soccer game. She proceeded to punch 2 boys in the nose and sent them to the teacher crying. The parents have followed the advice that you had given them 2 years ago, which was to not make a big deal about their daughter's gender feeling, but to give her some room and not force feminine stereotypes on her. They are now both worried because they feel their daughter's gender feelings are causing problems. This is gender dysphoria. She's getting upset and she's punching out the boys and so forth. They recently saw a Dr. Phil show about transgender kids and wonder, is our daughter a transgender boy? So how would you respond at this time at age 7? What we look for in that word strong and persistent is a very important word in the trans vocabulary. If those gender dysphoric feelings are getting stronger and are persisting, it's more and more likely this individual is going to be a transgender adult. At this point, though, I would certainly say at 7 is a good possibility they wouldn't be. Okay. Any concerns, though, at age 7 that maybe you weren't as worried about at age 5?
Yeah.
Laurie's shaking her head. What are you worried about?
I think so, just because she's getting in trouble at school and things just don't seem to be getting any different for
Right.
her. But
So what would maybe you do at this point that a little bit more aggressively? And I think just to move things along, you'd probably try to get the family to, get more counseling, send them to somebody like Larry who could talk to them about their feelings. I've got a question for you, Larry, too, because Larry's a psychologist who's been seeing kids for 22 years? No, more than that probably. But anyways, but what is coming down the road here? Just in the distance of this 7-year-old kid, there's a locomotive headed at this kid.
hormones.
What is it called? Yeah, puberty. Okay, so puberty can be a very destructive force in a transgender kid's life, because all of a sudden, their body betrays them. So at this point, we start to talk about that and talk about the possibility that, we need to make some decisions, because as we'll talk about in the next go around here, there are things you can do to kind of avoid that puberty.
Can I just say something?
Yes.
I think we're all, implicitly, we're all saying it to ourselves and feeling it, but it's really,
I need to reaffirm that it's really important for parents, and this is what they should be told, to reaffirm with their child that no matter who he or she turns out to be, they will always be loved and accepted by those parents. And supported.
Mhm.
And that's something I think needs to be reiterated on a regular basis? I mean, that's parenting. We all know that, but we didn't say it, so I just needed to say it.
No, but it's because one of the things I worry about is that a transgender child who has parents that bring them into the doctor and want to talk about these things are really lucky, because many times they aren't. You know, they have these feelings and the kid realizes bringing up these things are not going to go well in the family, and these kids can get brutalized both at home and, you know, in school. So let's move on a sec here.
If I may, we had a comment from one of our Zoom viewers. Suzanne mentions that another important thing to do at this point is to get support for the parents to understand the challenges of raising a trans kid. So that's another thing to probably bring up with them.
I think that's, you know, there are some organizations that are active in some areas where parents of transgender kids get together and can help support each other. Also, I think it's important to get involved with the school, because that's where some things can be happening where the kid is getting harassed in school, and very often talking to the school nurse, you know, maybe they may be aware of that. Okay. So Alice, who is now 10 and a half years old, comes in to see you with her mother, since Alice appears to have some early breast budding, which for a female, a genetic female, that's the first signs of puberty. That was noticed when she was taking a bath. Her father also says she smells a lot after she plays soccer with the boys and has some BO. You ask Alice if everything is okay, and she thinks for a moment and says, "I think it sucks, and it's really unfair that my little brother has a penis and I don't." When asked if she thinks she is a girl or a boy, she immediately responds, "I'm a boy and I've always been a boy." The family has been seeing a family counselor for a few years periodically. These discussions have been focusing more and more on Alice's gender dysphoria and her insistence on that she is a boy. So how would you approach the discussion at this point, and what would you tell the parents about Alice definitively are not being diagnosed as a transgender male, and what options would you present to Alice's parents at this point? So this is where I think some people are going to feel this is controversial, but you know, we have the ability, we the physicians, medical providers, to suspend puberty. Puberty is your pituitary glands up here. My testicles are here and ovaries are here. What puberty is that the pituitary starts to make FSH and LH, which stimulate the ovaries or the testicles to make hormone, testosterone or estrogen, that puts an individual into puberty. Okay? Now, there is medications that can be either injected monthly, or you can actually put little pellets under the skin, teeny little pellets, that will actually suppress the FSH and LH, that will prevent you from actually going into puberty. And you know, there is a condition called precocious puberty, where 5 and 6 year old kids went into puberty way too early, because that can cause bad things to happen with their bone growth and so forth. So we've always been able to use this medication to suppress puberty. Well, here you can introduce it at age 10 and a half, as all of a sudden puberty is about to explode on this child. And it doesn't mean you're saying this is clearly and definitively a transgender individual, but it gives you a few more years to talk about that. And most important, it prevents puberty from exploding on this kid. And if they are transgender, that may lead to a lot of gender dysphoria. Now you might say, well, gee, what, you know, doesn't that do irreparable damage to the kid if they don't go into puberty, and then you let them go into the regular puberty because it's decided that they're not transgender? Not really. You can catch up. Okay. So, anyways, that's what are the possibilities of that. Does anybody think that's outrageous? You know, are we playing Mother Nature, Father Nature?
I thought there's been some research that suppressing puberty can lead to some problems later on, and that some children who were treated with those drugs then became sterile. Is that true?
You know, the best data comes from the Amsterdam clinic, where they started to do this in the 70s. And in follow-up, there's actually relatively little bad side effects. Now, allowing kids to go through quote, the wrong puberty can have devastating effects. So you've got to balance that off. You know, things like bone density, you know, won't accrue as much because when you go into puberty, you start to make thicker and thicker bones. Most of that you can catch up with when eventually this kid will go into puberty, maybe the opposite puberty than say the female puberty that she was going to go through. But so I think that whatever risk there is, I think it's minimal, and certainly when you weigh it against this kid at age 10 and a half that has this strong and persistent feelings, you know, you're pretty darn sure this kid's gonna either be a trans man or a you know, non-binary individual in the future.
The other time that delayed puberty is done is with a kid that isn't growing satisfactorily. You want to give him growth hormone, but if he goes through puberty, that may steal his growth. So you want to delay the puberty to let the growth hormone have enough years of action so he can reach whatever height you've assigned would be important.
Yeah. And the other thing I'd say, the other condition in endocrinology is delayed puberty, late bloomers. This is relatively common in boys that don't go into puberty. You can all remember the boys in this class, you know, remember in 7th and 8th grade, the girls just got so much taller so quickly and we were still about this big. But boys can go into puberty. So, you know, sure, psychologically that can be difficult, be a late bloomer, but again, you can catch up. So somebody else had a question here? Yeah.
Is it relatively easy if you induce delayed puberty and decide after 3 or 4 more years that the individual is either trans or cis, to then choose which puberty type, male versus female, to give with hormone?
Yeah, absolutely. This kid here, let's say 2 or 3 years I these gender dysphoric feelings start to kind of minimize and actually go away. And Alice is saying, I don't identify, maybe I like to play sports, but I'm not going to identify as a male. You could stop this medication and she would go into a female puberty. Okay. The next slide is going to answer your question though. Could you then could you have her go into a male puberty? Okay. Any other comments here? So, okay, Alice comes in for an appointment having just celebrated her 13th birthday. Last we talked to her was 10 and a half. Okay, her name is now Chip and her pronouns are he, him, and his. Chip has had histrelin acetate, which are these pellets I mentioned to you. These are gonadotropin releasing hormone is the actual name of it, implanted in his arm, and for now, and for a little over 2 years. Chip and his mother both report no further evidence of him going into puberty. And we actually measure hormones to make sure they aren't going into puberty at that point. And this medication is very effective in suppressing that. Okay, Chip's mother wants you to know, Chip's mother reports that he seems extremely happy and is doing very well in school. She proudly relates that he has recently been elected captain of the 6th grade #1 soccer team, which is made up of all boys, including Chip, plus 2 girls. Chip's mother wants to know, what are the future steps my husband, Alice, and the mother should be using Chip at this point, expect over the next few years that will help support our son to live a happy and successful adult life. What do you think, Chip? When do you think Chip should start testosterone? So this is happening all the time. We at Dartmouth are doing this puberty suppression. It was, as I said, first started in Amsterdam, and Boston has a big center, and there's now 8 or 10 centers around, if not more, that are doing this. And what typically would happen is that during this period of time when you suppress the puberty, the family and the kid is still having some counseling. And then at some point, if it's clear that this person is a transgender individual, then in Chip's situation, at age, and traditionally in Amsterdam, it was at age 16 because that was the age of majority. The kid could choose to then start on testosterone and go into that puberty. In our country, it's the endocrine society recommendations are at 16, 17, or 18 to consider doing that. Okay, and then what other things? We haven't talked about this, but gender affirming surgery. In this kid's situation, breast reduction surgery, vaginoplasty, there's all sorts of surgery. That's down the road. Probably no surgeon's gonna do that on a kid that's not at least 20 years old and has been transitioned on hormones for 2 or 3 years. So, we won't talk about that right now. So that's, what's happening to more and more kids. And this question that we had at the beginning, where were all the transgender kids when we were growing up? Well, I think they were there. But, this whole identification with transgender just wasn't available. Without the internet, kids had terrible feelings. They had bad feelings about their body and so forth. And they couldn't put their finger on it. And it was interesting to me. I think I first saw my first transgender patient in 1982. And these individuals would say at 25 or 30, I had something that just wasn't right, but I could never figure it out. And now I know what was wrong. Or they would say, I've been living a lie and I can't do that anymore. I want to transition. So now what's happening is that both parents and kids and society are getting more educated at an earlier age. So these individuals and these feelings are being recognized for what they are. I really am interested to hear if Larry could tell us anything about your observations. Do you think in retrospect, did you talk to kids that had gender dysphoric feelings in retrospect that weren't recognized?
I didn't understand fully what you're saying.
I'm just saying, when you look back, did you see kids that you were counseling that in retrospect, maybe these were gender dysphoric feelings?
Generally, it's an issue with the family that I see mostly. I'm thinking of a particular youngster, well, I say youngster, he's 20 years old now, and has been through everything. He's getting ready to have a mastectomy. And the parents are very religious, and he's basically been alienated from the family. So there's a side issue of dysphoria and working through the relationship with people who support him. And he has a remarkable group of young people who support him, his friends. And locating those sources of support, I think, is the main issue in the kind of work that I do.
Thank you. Emmett, do you have any comments about grandparents who may know of grandchildren or friends of grandchildren?
Yeah.
We were talking about this, Jack took me to dinner before this, we were talking about this, because one of the question was, well, we never heard about trans people, this is a new thing, this is like a new Gen Z thing for attention. But that's not the case. If there are people in this room who have kids or grandkids, anyone? Anyone? Yeah, so if you have kids or grandkids, your kid could be queer, which actually, I don't know if I mentioned the word queer. Queer is a term, it's an umbrella term, essentially meaning, essentially meaning not straight and not cisgender. So somebody who's a member of the LGBT community. Historically, it's been used as a term to be degrading towards the LGBT community. So some people are taking that term back and claiming it with empowerment, So where's that thought going? So the whole point, right? So we were talking at dinner and he said, well, a lot of these people might be older and they're gonna think, well, I've never met a trans person before, and trust me, you have. And the reason for that is that, if you have kids and they have kids, or they have kids, then they could be LGBT. So members of your family could be LGBT. And even if they're not, then they have friends in school who are. So you have an influence on your kids and your grandkids and your great grandkids in terms of being able to be a positive influence on them and their viewpoint on people who are LGBT. So even if no one in your family is LGBT, you still have the ability to be a positive influence on other people in your community.
Can I also chime in on this?
I was going to just ask you to do that.
Excellent. So the other thing I want to mention about why are we only now seeing trans people? Well, a lot of that also has to do with just the accessibility of discussing these things. Like the word transgender wasn't a common word 100 years ago. And even as recently as a few decades ago, it was heavily stigmatized. So the reason that you're seeing more transgender people now is that they finally feel safe enough to let you know that about themselves. And they finally have the words to describe the feelings that they've been having all along. So that's the important thing to think here. It's not why are there more trans people now, it's why is it only now that trans people feel safe enough to actually tell me that they're trans. The other point about how you probably know a trans person, even if you don't know that, trans people are more common than people from Boston, and you probably know someone from Boston, right? So like it's statistics. You don't necessarily know a trans person, like maybe you just happen to know all sorts of cis people, but the fact of the matter is that, you know, you can't tell if someone's trans always by looking at them, and they won't tell you if they don't feel safe doing that. So, you know, if you make it obvious that you're someone who is supportive of this, that even if you don't understand it, that you'll believe them and you'll try not to misgender them and that you're safe to talk to, suddenly you'll find trans people coming out of the woodwork. And this is actually an experience that therapists have. Therapists who are trans friendly and well-versed in these issues, they'll quickly find that all of a sudden all of their clients are trans because word of mouth went out and let all of the various trans people in the community know that this was a good therapist, right? So it's like that. It's not that trans people haven't been here, it's that now they're visible and that now they feel safe enough to come to you and talk to you about it. I've also got some questions that have collected from Zoom, so I don't know when a good time to put those in here is, but if we're almost finished with the discussion of this case, now might be a good moment.
Let's do it.
Yeah, okay. So we had someone write in, Paula Dorr asks us to please address sports locker rooms. I think that's relevant, like address it in the context of the case that we were discussing.
Yes, that's a tough issue. The whole thing about, and in New Hampshire, there was a bill that was passed last year that prevented trans boys from competing against, in some situations, cis females. I don't know what the answer to that is. I played a lot of sports and I can understand the controversies about that. Quite frankly, I think it's relatively rare enough that, if we're gonna have girls compete against girls, then a trans girl should be able to compete against cis girls. But that's my feeling, but I realize that may not be. How do you feel about that?
Well, one thing people may not realize about the whole controversy over trans people participating in sports is that trans women, since they're usually at some point taking hormone blockers or hormone suppressants, they often frequently have lower levels of testosterone than cis women do, right? Because everyone's body naturally produces a little bit of testosterone. And even if testosterone were the only thing which mattered to sports performance, which it isn't, right? Obviously there's training, there's a bunch of other hormones. I mean, we have an endocrinologist here who I'm sure could go into detail on that. But even if it were the only important thing, it also doesn't distinguish trans women from cis women. So from that point of view, about competition, I don't think that there's too much to worry about there. I think that you should just let people compete with the gender that they say they are. And if you're like an Olympic athlete at the very peak of your field, maybe that matters and maybe that's a matter for a committee, but either way. The question though, I think was about locker rooms in particular, because even if you're on hormone therapy, it doesn't magically change genitalia. And the answer to that I would go with is let people change privately or don't worry about it, one of the two, right? Like, unfortunately, I didn't realize I was trans until after I'd already left high school and stopped doing high school sports. So I don't have like a first person account here, but in the locker rooms at my high school, there were separate little cubicles right near the bathrooms. I think there's nothing wrong with that or letting someone change in the office. So more generally, whenever you have a situation like this where there's some very gendered thing like locker rooms or bathrooms or team sports and you're worried about accommodating trans people, I think it's important just to remember that, hey, it's okay. Like we can just do the sensible, reasonable thing, like let them change in the coach's office or in a cubicle, or just let them play on the team and don't worry about it too much, because it's not high stakes. Like these are, in this case, it's children's sports, even more generally in professional sports. It's not like nuclear bombs, it's sports. It's okay to just do the reasonable, simple accommodation. And there's plenty of people who need accommodations who aren't trans. Like look at disabled people, maybe, who need some kind of accommodation to play. So that would be my response. I don't know if Emmett had anything else to add to that question, or if we want to move on to the next one.
Yeah, I would, I should probably wait for the mic.
I think the thing I would add is that I would ask the kid what they want. What are they gonna be comfortable with? Because if we have this kid, Chip, was it Chip? Yeah, if we have Chip playing on the soccer team, is Chip gonna feel comfortable changing in front of the guys who are beating him up? Right? Like, we haven't talked about Chip and his feelings and how he's gonna feel safe doing that. We've talked about how we're gonna make the cisgender people feel safe and comfortable, but not how we're gonna make him feel safe and comfortable. Right, and so if folks are uncomfortable changing in front of a trans person, I'm sure that they can use that cubicle if they want to, but I don't think that it's necessarily in the best interest of this transgender athlete to single them out and require them to change separately, but that would be my opinion.
Yeah, I think the sports issue is an interesting one. There was an article I was reading that talked about there's like 64 genetic abnormalities that gives you an enhancement of your athletic prowess. And there was, for instance, there was a cross-country skier in the '64 Olympics that won 4 gold medals, and he had a genetic mutation that he made more red blood cells. So he had very high red blood cells, which meant he could deliver much more oxygen to his muscles. Will Chamberlain, I should show it to you, his 4th grade picture, you should see this. He was 6'4" in 4th grade. The kids were this big. Now, did he have a genetic advantage? He certainly. So if we start to look at all of these 64 different genetic abnormalities or variations and not allow people to compete against each other, pretty soon, we're not going to have any, competition. So I don't know. Any other feelings about that question, or we'll go on to another one? Go ahead, Dark. We got another question?
We have so many questions. I think you also, though, you might also have a list of questions that were submitted previously. I don't want to push those out. So what do you feel about alternating, maybe?
I don't think we have a list, so go ahead.
Oh, well, in that case, one of the questions from Zoom was what happened to the list of pre-submitted questions? No, okay, next question. We have someone here named Steve and he's asking, is it always appropriate to recommend puberty deferral as a response to gender dysphoria?
Is it always appropriate to recommend puberty deferral? Oh, you mean to suppress puberty?
Yeah, is that always an appropriate response to a child experiencing gender dysphoria?
I mean, I think we need to let the parents and the child know that is a possibility. And, I think if they choose to do that, then I think, that should be offered to anybody who has strong and persistent gender dysphoric feelings as they're about to go into puberty. They ought to at least know that that's an option. Now, to be honest with you, a lot of it is financial, insurance, all of that not all of these kids have access to it. But I don't see any reason why I wouldn't, make that available to a family that's coming to grasp with these issues. Yes.
Are there any organizations that support paying for children who aren't financially stable enough to afford that kind of thing?
Emmett, do you know any, Emmett's been looking into this for individuals who are transgender and seeing if they could find some financial support.
Yeah, I mean, well, children, at least in the state of New Hampshire, can qualify for Medicaid. Medicaid does cover these services. There's a lot of sort of requirements that are outlined by the WPATH Standards of Care. So WPATH is the World Professional Association for Transgender Health. they have 7th edition there, in their 7th edition, of the standards of care for transgender medicine. So how transgender people can access care, what they need to do to access that care. And so children need to have a mental health letter written indicating that they are ready to start puberty suppression, and then another one to start hormone therapy. So there's a bit of a process there, but the insurance piece in terms of accessing that coverage, Medicaid does offer that coverage. So that's like the best route to go.
Next.
All right, next up, we have a question from Nancy. In the 70s, all babies with ambiguous genitalia at MGH were surgically made with girl genitalia. What is happening now?
I'm not a pediatric endocrinologist, but from what I understand, as I alluded to before, this is become a very strong debate. And I think now, from what I understand, they're backing off. What the recommendations are is that some individuals need to have emergency surgery if their, urinal tract needs to be, is compromised because of the ambiguous genitalia. They may have to have some surgery, but otherwise the feeling is to not do any irreversible surgery until you can get some input from the kid as far as their gender identity. But it remains controversial, so.
All right.
Maybe one or two more questions. Any from the audience that people are wanting to ask? No? That's not a question, right? You were just scratching yourself? Okay.
Any more on the Zoom?
Yep, I've got one last. There were a few people who brought up points about how when you're talking about a non-binary person, the pronouns aren't the only thing to notice. Like, for example, you might want to call someone a child instead of a daughter, or a parent instead of a father. But the last question I think we have was from an anonymous attendee who asked, so I have a teen who identified with their gender without any pressures from us. Like on their own, they wore clothes their gender wears, like the opposite sex, etc. They had strong likes and dislikes, and we always supported them. In the last 6 months, they went from bisexual to a lesbian to now gender fluid. We're fine with however they identify. However, I do question this seemingly quick change. They've also begun to spend more time with others that are gender fluid. What do you make of this? I would also like to find a support group for myself. Do you know of any? So if that's all right, I want to answer this question first. And I already put this in chat in the text, but broadly, the thing to realize, I think, here is that sexuality and gender are not necessarily related, right? Like that's what we were talking about with the gender unicorn image. And so the fact that a teen or a child, or not a child in this case, but the fact that a teen is experimenting with different labels for themselves and potentially switching quickly, that's not anything to worry about, right? Like your teenage years are already a period of exploration. And often when you have these feelings that are kind of atypical, that aren't an ordinary experience, it can sometimes be hard to find appropriate language. And that's part of the reason there's so many different words, is that everyone's kind of reaching to find words that describes their experience. So my reading of this question is that this teenager at first was like dealing with feelings of attractions to girls and was trying to like work out what was going on there and tried out a few different labels for their orientation. And then in doing that, they like figured out, okay, this is how I'm feeling attraction wise, but that makes me realize there's other things about my gender that, maybe I wasn't questioning it or thinking about it because I thought I was like all repressing all this, but now I'm unpacking everything and I figured out the sex thing. Now I'm figuring out the gender thing. And now they're calling themselves gender fluid, and that's fine. That's normal. That's a process of exploration that we would hope people go through. As for the last bit about spending time with other gender fluid people, I don't think that's something to worry about. If your child suddenly starts spending a lot of time with trans people and you're worried that it's going to, influence them in a bad way, well, don't worry about that, because it might even be the other way around. It might be that your child was already trans, was already struggling with this, but now they found a support group where they can discuss things with their peers and they can, actually discuss shared experiences and feelings with a friend group. And that's great. That's good. And then the final question about support groups, I mentioned specifically PFLAG. It's short for Parents of Lesbians and Gays, but it is now a support group for parents of all kinds of queer people, transgender people included. There are a few other groups like Seacoast Outright that kind of operate through all of New Hampshire, but I think Dr. Turco might know of more local resources that you might want to look into. So I can pass it over to him.
Yeah, this is a great time maybe for Emma to talk about the hotline where this information you can get.
Sure.
Yeah, so we have like a phone number that folks can call. I can put it in the chat so the folks in the Zoom have it. But folks can call that number and get connected with our transgender health program at Dartmouth Hitchcock. And I'm that direct contact person. So if somebody's calling, they're a parent of a 6-year-old, they want to get their 6-year-old connected, I can help them with that referral process. If somebody's like, oh, I'm 74 and I want a vaginoplasty, I can help them with that process. So whatever they're looking for, it doesn't matter. They can call and leave a message and provide them the support they're looking for.
Great. Well, I think we're getting about to the end, and I want to thank everybody that came here and online. If there's any questions, we'll hang around afterwards, and also don't hesitate to get in touch with us. I don't know, Mary can make my email available, but thanks a lot, and give us some feedback. Was this helpful? And is there anything else we could do about transgender or gender non-conforming patients in the future? So thanks again.